Hi, Jim Marshall of the New Bedford Cable Network, and we're at the Greater New Bedford Community Health Center in downtown New Bedford. The center has expanded its COVID-19 testing with an on-site outdoor tent that will allow more people to get tested here at this location. We're about to go in now and take a look at the testing site and talk to CEO CHERYL Bartlett. All right, we're inside now talking to CEO CHERYL Bartlett of the Greater New Bedford Community Health Center. Thanks for having us. Tell us a little bit about what prompted the expanded testing and at least some of the procedures, how to go about it.
I think as we start to consider how we might reopen the state, the governor was really clear that we needed to get a better handle on were we really seeing a plateauing of the virus transmission, and was it safe for us to begin to move in this direction? And so one avenue that we need is more testing. And so a lot of the amount of testing has been determined by the capacity, and that is the number of tests that are available. And so we've been kind of limited in that capacity. So we were selected as one of 12 community health centers to expand testing so we could start to really see what the prevalence and incidence of this coronavirus was.
Obviously, the organization's been very busy in the past few months dealing with this. How does this tent, I guess, help you with the daily operations of the center?
So most of the on-site care that we're giving right now is related to people with respiratory conditions that are presumptive to be coronavirus. And so we move most of our other care to telehealth. And so in order to increase the amount of tests that we can do, we needed to get in a place where exposure was limited and that we could keep patients moving in and out of here. And when you test in an exam room, for example, you can't use that room for 2 hours. The test itself creates a high probability of coughing. We take a nasal swab and we put it in through the nose and into the throat. And as you might imagine, that's an uncomfortable procedure, and it creates a cough, and cough creates droplets, and droplets is how the virus is transmitted. So we have to vacate that room for 2 hours and let the virus dissipate, then go in and disinfect it. So that really limits the number of tests that you can do. We had a clinic area where we were doing COVID testing prior to this expansion, and we had 20 rooms. So if 20 rooms in the first hour get used, we have a 2-hour delay in when we can do testing. So coming out into a tent where the air is circulating, we don't have that restricted air environment. We can test about 4 people an hour with one team here.
We've seen people coming in here while we've been outside here. It's not a walk-in. There are procedures. Why don't you tell us a little bit about how people can actually go about getting the testing here?
Great. You can call the main number of the health center. We have a couple of people that are trained and ready to take all the calls for appointments for testing. And we will schedule first a televisit where a provider will do an interview with you, identify what your symptoms are, if you're a presumptive case or not, and then we will schedule a time for you to come in and get tested. So the testing part alone is pretty quick. You have an appointment, you come in, you're pre-registered, we just confirm everything, do the test, and send you on your way. So a pretty rapid turnaround for people.
So it's a referral too. You need that initial doctor or medical person to say, yes, you should go get tested?
No, we are actually taking people that don't have a referral. If someone has a primary care provider, we're encouraging people to go to their own primary care provider. Hawthorne is testing their patients. South Coast is testing their patients. But we won't turn someone away if they come in and talk to us and can't, for some reason, get to one of those other places. In a few circumstances, we've seen that. We will test them, and we will test our own patients, and then we'll test anyone that maybe doesn't have their own primary care provider. So it's a self-referral that people are concerned that they've been exposed. It's primarily still focused on people that are symptomatic, that we think are presumptive cases, but in high-risk populations and essential workforces, we're testing a lot of folks from nursing homes, homeless shelters, and a lot of people from the fish houses here in New Bedford.
You were saying off camera too that you have enough tests for I think 50 a day. So you're hitting your goals here early too, which is a good thing as well.
Yeah, Monday, which was our first full day of testing, we tested 46 in the 10, and we probably tested a few inside. So we're hitting our 50, which was the expanded number we said we could make, but that's not the ceiling. Really, we projected, because when we were asked to expand, we were doing about 10 a day. Then we went to 20 to 30 a day, and now with more tests, we can really open up the floodgate, so to speak, and invite people to come in and get tested.
When you were in the studio about a month and a half or so ago talking about this testing, you mentioned that then, in general, how important is the testing in the overall scheme of things when we're talking about the virus?
Well, what's important is when you test someone, particularly those that are positive, they get reported to the State Department of Public Health, who sends those test results to each city health department, and the city health department then does what we call contact tracing, which is call the person up, identify where they've been over the previous 48 to 72 hours, which is most likely the more infectious time that they were with the virus, and see who they might have exposed, what their household situation is like, are people in close contact that might need to be followed up with and offered testing themselves, where if they're working, what is the work environment like, and could they have exposed people on the job? And that just helps us try to contain the continuous transmission of the virus.
Tell us a little bit about the staffing for this. You mentioned off camera a little bit, but I know we're going to go in there, but just tell us a little bit about what staffing looks like in the hours of operation.
So we are testing from 8:30 to 4:30, and we take about 45 minutes where we lock down for lunch, just because people really need a break and to get out of there. Our team has been primarily a provider. It's been a physician so far, and a nurse, a medical assistant, and a registration person. So each person has a role, and one is prepping the patient and making sure all the information we got on the telehealth visit is accurate, officially registering them so that we can then bill for that visit, and then the nurse and the physician work together to collect the specimen, prepare it to be sent off to the lab for testing.
And how long will it take for folks to get those results?
It seems typically it's been on average about 48 hours, but anywhere from 24 to 72, depending on the volume of the lab. This is a partnership with the state and Quest Laboratories, is how this expansion has been able to happen.
And again, just so I review too for folks, if people want to get it tested here, what should they do again?
Again, they can call the Greater New Bedford Community Health Center main line. Eventually we'll have a hotline that hopefully we can post, but in the short term, that number will be referred. We have a dedicated extension within the facility, 2 extensions, and there are 2 medical assistants that are receiving those calls and screening patients, identifying if they are symptomatic. That's just important to collect that information. Is it a symptomatic or an asymptomatic person? What their insurance are, if we can bill. We're doing this regardless of ability for people to pay, then giving them an appointment to come to the test. It's been a pretty quick turnaround. You can call in the morning and sometimes get an appointment in the afternoon. Today, for example, we spoke to a nursing home in Fairhaven, and we tested a number of people from that facility. And so right now, we seem to have the capacity to do a quick schedule and get you in here.
Last thing, can you talk about your staff and how they've been handling not just the tenting, but overall?
Right. It's been a lot of stress, as you might imagine. This is a new disease, and we're learning new things about every day, how it's transmitted, the incubation period, it's pretty long, 2 to 14 days, and then how to manage exposures, how to help people get into isolation. So it's changing how we do our work almost on a day-to-day basis. So that's a lot of stress to come in and not know exactly what you're going to do. Most people are wearing 2 or 3 hats. What I said to them at the beginning of this, I think when the governor declared an emergency, that last sentence in your job description that says other as assigned, and most of us are doing other as assigned now. So that makes for unsettling times. You know how to go in and do your job, and we're asking you to do jobs that you maybe never did before. We're changing what the directions are of how close and how long you can be near someone, how long you can work in the tent and get out of there. So a lot of change and uncertainty, and I have to say they're doing a remarkable job given all of the uncertainty. And of course your own anxiety, right? You don't want to get infected yourself. People have children, family, elderly parents and relatives. So there's a lot of underlying concern of our own. But yet, as it is Nurses Week here, I'd like to shout out all the nurses and say that nurses and doctors are really fulfilling the oath that they take when they go into these professions.
And they seem in good spirits. And the couple that we've talked to out here, they very upbeat, very, I don't want to say happy, that's probably not the right word, but very upbeat.
Yeah, I think we have a great team. I think we have a lot of respect for one another. We have our values, which we attribute, we call it pilot, is that we have really tried to change our culture here to be a team, to be respectful to each other, to be respectful of our patients and keep our mission in mind, which is high quality care, and to improve the public health for the communities that we serve, and to have fun. I'm a kind of fun-loving, happy person, and I like to instill in all of us that we're here sometimes more than we are at home, and that we need to have a little bit of fun with each other, despite the conditions that we're working in.
So we're about 10 to the 10.
Yeah.
You were saying that obviously this is sort of the waiting thing.
This is our waiting area where we typically don't have more than 2 people here at a time, but we could have up to 4 because we'll schedule 4 within an hour. So if someone came early or someone was late, but we have chairs appropriately separated so we can keep that social distancing. And so they would wait here until they got called into tent. We take 1 patient at a time inside the main tent at this particular point in time. If we got busier, we could do up to 2 teams and 2 people every 15 minutes.
I didn't realize that the tests really don't take that long.
No, it's really a quick swab in the nose, down into the throat. Might take a few minutes because sometimes it's hard to get that in. It causes people to cough, and it's not the most comfortable thing to do, but so probably about 5 minutes in and out if we've done all that pre-registration and telehealth visit, and someone really wouldn't come in here if they didn't have those things already in place.
Doctor, how important is this testing site when you're looking at this disease?
I think in the city of New Bedford, we are very important because we are serving the underserved community, the low socioeconomic group, and from the data overall, we know that this group is especially impacted, and that's what we are seeing here too. So we're seeing a lot of people who live many people live in one house, and they get infected from one another. When they go to work in different businesses, they can get infected there. So we're seeing that trend in New Bedford.
Sounds good.
Yeah. I would also jump in and add that we serve a high population of people with limited English language, and so that a majority of our staff are bi and trilingual, and so this particular past few weeks we've seen a lot of the Spanish-speaking population coming in, so I think that we're known for doing a good job with immigrant communities and can help them understand what we need to do for them and how to go home and take care of themselves. So I think that the populations Dr. Naz mentioned really rely on us for their health care.
How is New Bedford, I guess, from what you guys have seen over the past few weeks, how has New Bedford just overall been doing? It seems like social distancing, people haven't, in general, people are doing okay.
I would say that I've been impressed with the mayor's leadership. He's pulled together an emergency preparedness team that's been working really hard. Every single day there's a call that has South Coast, Hawthorne, the health center, emergency preparedness personnel, the health department. And so we really talk every day about what we're seeing and how we're going to address it. He's issued a number of executive orders that I think have helped with this. So I think that, in addition to the fact that we're a little bit removed from the epicenter in Massachusetts, that I think we're slower to start to see the virus transmission here, and we haven't really hit the peaks that have been seen in some of the other gateway cities that are closer to Boston and that epicenter.
You see the same thing, just people seem to be doing a good job?
Yes, I would agree. So I think the community, hospital, and leaderships are all coming together. We do almost daily, weekly calls ourselves in the medical community to understand how we can help our patients in the community here.
Sounds good. So are you seeing a lot of patients that have other, like, I won't say illnesses, I mean, they may think they have COVID-19, but it's pneumonia or flu or something else?
Yes, so we are seeing patients who would at this time if corona was not there, they would have other bacterial infections, they have heart failure or heart-related issues that can give them shortness of breath or cough. So we have to deal with all their chronic medical illnesses. And then we test them for coronavirus if they have symptoms that are compatible, which, then we have to differentiate which one is causing their real disease.
And as you mentioned, which was curious too, allergy season.
Right.
It's rampant right now. I know my wife
uses
Zyrtex every night. And
yeah.
I guess somebody initially might think, oh my gosh,
yeah.
I'm sick.
I think when you're doing this every day, I myself have terrible allergies, and I wake up with a sneezing or coughing, and I think, oh no, have I finally gotten it? And then I take my Claritin, and within a half an hour I'm fine. But it's hard because it's like there's so much focus on coronavirus that I think the governor even said this yesterday. People aren't coming and taking care of their other somewhat urgent healthcare needs because there's such a focus on corona or a fear to come in contact with the healthcare system that we really can manage both. Inside the health facility here, we have a urgent care for non-COVID suspect patients. So if someone has a problem with their diabetes or hypertension, we're still seeing other urgent care related health conditions, and I think that sometimes gets lost in the middle of an emergency.
And you've got full garments and what have you, and obviously you guys are taking the precautions so you don't get sick, which is obviously so important.
That
the work
is.
you're doing.
Exactly. I think as healthcare workers, we're in the forefront of this. So people when we take their swabs, they may be coughing and sneezing on us. So PPE is very important for us to take care of our health.
PPE, personal protective equipment.
Is there anything that I haven't asked that should be mentioned? I know we talked about especially how it works and scheduling and what have you, but is there anything that should be said that I haven't asked, haven't thought of?
No, I don't think so. I think you've covered it. Again, I would just emphasize that if someone is a patient of South Coast or Hawthorne, that they try to get their tests done there. We all have been allocated a certain amount of tests, and they have thousands of tests available to them, and we get about 50 a day based on our projection of that's the number of people we could test in a day. So trying to make sure all of us have the supplies we need to serve the community.
Well, thank you both for your time. Thank you both for, I was going to say your service, but what you guys are doing on a daily basis. You guys are heroes, really doing a tremendous job, so thank you very much.
Thank you. Want to give out a shout out to all the nurses. Happy Nurses Week. They're doing an awesome job.
Yes, I already gave them a shout out, but I'm a nurse, so we'll shout it out again. Nurses rock.
Thank you.
Thank you.